Hello, my name is Opal, and for Module 10, I will be talking about health care and health challenges. So, in my first slide, health inequalities in the United States. Health inequalities are not just about personal choices, they are largely shaped by structural inequalities within society. This includes factors like income, education, housing, and access to healthcare services. For example, individuals from low income backgrounds may delay seeking care due to cost, while racial and ethnic minorities may experience discrimination or limited access to providers. The quote from Brave Men is especially important because it defines health disparities as systemic and avoidable. This means these differences are built into systems, not random. The phrase socially disadvantaged groups highlights that the disparities are tied to inequality in society. This helps us understand improving healthcare requires addressing broader social conditions, not just medical care itself. For my next slide, I will be talking about strengths-based support in healthcare. A strength-based approach focuses on what clients can do rather than what they lack. In healthcare, this means recognizing a client's resilience, support systems, and coping capabilities. For example, even someone dealing with chronic illness may have strong family support or effective coping strategies that can be used to improve their well-being. The quote from Selby emphasizes that all individuals have capacities and resources. This is important because it shifts the role of the social worker from solving problems to empowering clients. Instead of viewing clients as passive recipients of care, this approach encourages collaboration and promotes independence, which can lead to a better health outcomes. In this slide, I will be talking about bias and systemic barriers in healthcare. Bias in healthcare is often implicit, meaning it happens unconsciously. These biases can influence how providers diagnose conditions, recommend treatments, or communicate with patients. An example of this is when research has shown that some groups may receive less aggressive treatment or have their symptoms dismissed. In the following quote, it explains that implicit bias can influence clinical decision makings. This is significant because it shows how inequality can occur even when providers do not intend harm. Additionally, to bias, systemic barriers like lack of insurance, transportation issues, and geographic location also limit access to care. Together, these factors contribute to unequal health outcomes. In the next slide, I'll be talking about the ethical dilemma in healthcare for social workers. A major ethical dilemma in healthcare is resource allocation. When there are limited resources such as hospital beds, medications, or specialized treatments, decisions must be made about who receives care first. This creates a conflict between equity and efficiency. Equity focuses on the fairness and ensuring everyone has access, while efficiency focuses on maximizing outcomes, such as treating those most likely to recover. Social workers must navigate these decisions carefully, using ethical principles and professional judgment to advocate for fair and just outcomes. For my next slide, the NASW ethical principle, the principle of social justice is central to this module. Social workers are responsible for challenging inequality and advocating for fairness to healthcare. This includes working to reduce barriers, addressing discrimination, and supporting policies that improve access for underreserved populations. So, my thoughts about this module is that it's helped me realize that healthcare is not just about treatment, it is deeply connected to inequality and access. Many of the barriers people face are structural and not personal. This changed my perspective and showed me that improving healthcare requires advocacy and systemic change, not just individual care for a single individual. These are my references, and thank you.